Hey everyone, Azim here. We are starting a new chapter. This is chapter 7, the axial skeleton. We just finished chapter 6, where we went over different types of bone and cartilage. Here we're talking about whole bone, specifically bone in the axial region. Axial just means along the central axis. So we'll be talking about the bones of the head and the vertebrae and the thoracic cage. We'll also, in the next chapter, talk about the other bones of the appendicular skeleton of your limbs. So, of course, we'll understand the function of this central axis of the skeleton, the different bones of the cranial region, the face, the vertebrae, and the thoracic cage. So a lot of different bones, and we're going to get to know all of them. So it might seem like a lot. It will initially, but we'll get used to it as we go through it. It will be important to know different landmarks, different bone features of these different bones that we're going over. We're not going to go over every single bone landmark. We're not going to go over every single little feature. We will go over a lot, though. I have a full list of those terms in those individual chapter study guides, and we'll be going through each of them today. So when you think of the word axial, at least when I think of the word axial, I think of an axis. Our globe spins on an axis, or this model of the Earth spins on an axis. That's what axis means. It's the central part. In this case, it's spinning. Our bodies don't necessarily spin like that, but it's the central thing. It's the central plane. What's the function of the axial skeleton? The axial skeleton has lots of holes in it, specifically in the face area. These holes allow us to experience the world. We can see with our eyes, we can hear with our ears, we can taste and breathe with our nose and mouth. A lot of different sensory specializations in this area of our axial skeleton. You'll also notice that our axial skeleton, much like a bridge, has a lot of curvature to it. Curvature is very supportive and protective. Our cranium is made of a curvature to provide support. And our vertebrae also has curvature to it. You can see, we'll see the different curves of the back that provide stability for all the weight that's being pulled down, especially as we're upright, as we stand upright. Finally, we have a cage. The purpose of a cage is to protect something. You're protecting a bird and providing it housing. What we're protecting with our thoracic cage is our lungs, our heart, are very, very vital organs for survival, and other things that are in there, which we'll discuss further. So overall, the axial skeleton is in the central axis. We can use it to experience the world, to sense what's going on, special senses like vision and taste and smell and hearing. There's a lot of curvature for support and a cage that provides protection. There are 80 bones in the adult axial skeleton, 80 bones. They're all listed here. We're not going to go through each one at this moment. We'll go through them one by one. But generally, they include bones of the skull, the whole head, something called auditory ossicles. Ossicles, remember the word os? Os means bone. So ossicles means little bone. Like an icicle is a small piece of ice. It's not necessarily small, but it's a piece of ice. Ossicle is a piece of bone. Small piece of bone. They're for hearing. We have bones that are necessary for us to hear things. So we'll talk about the auditory ossicles. There's a bone called the hyoid. Maybe you've never heard of this before. We'll go over it. The bones of the vertebral column, the vertebrae, the sacrum and the coccyx, and then the bones of the thoracic cage, the sternum and the ribs. That's what we'll categorize here as axial skeleton. In the next chapter, we'll go over appendicular bones, bones of the limbs, the pectoral girdle, and the pelvic girdle. These divisions are purely human-made. It's just, how we feel like it's easier to categorize. So the fact that we've divided it up like this is just because we think it's easier to remember. As I've been saying, very generally, the axial skeleton is a great framework. It's in the central axis. It's a great framework for muscles and for supporting organs. We are protecting organs in our ventral body cavities. The ventral would be the largest ventral cavities would be, the dorsal cavities. The largest dorsal cavities would be the cranial and vertebral or spinal. Vertebral, there we go. Protecting our brain and our spinal cord. Ventral body cavities, that would be the thoracic cavity as well as the abdominal pelvic. Abdominal pelvic we'll get to more later, but thoracic cavity we'll be talking a lot about today. We are protecting special sense organs for taste, for smell, for hearing, for balance, for vision. And there's a lot of attachment sites for muscles. Adjusting your head and neck and trunk, moving your thoracic cage for breathing, for respiration. Respiration is just a fancy word for breathing. And for stabilizing your appendicular skeleton. These arms and these legs, in order for them to be able to move and do things, they have to have a solid anchor in the pectoral girdle and in the pelvic girdle. So we'll focus on the skull first. This is going to be in a set of videos. We'll focus first on bones of the cranium before we get to bones of the face and the hyoid and auditory ossicles. What these bones of the cranium are these are bones that protect the brain, that are immediately bordering the brain. For example, the mandible is not bordering the brain. The mandible would be considered a facial bone. The cranium, like frontal bone, parietal, occipital, these are bones directly bordering the brain. Those are cranial bones. Both the cranium and the face, they're both part of the skull, but we're going to focus on the cranium first. Before we do that, it's important to understand a little bit about development here. We've learned about the different types of ossification. Don't forget what those things are. There was endochondral, where you come up with a framework, but there was also intramembranous, where you start from mesenchyme and then skip over to bone. So there's no cartilage in between, there's no cartilage step. With intramembranous ossification, we're producing lots of flat bones. And most, not all, most of the bones of your cranium are flat. They're fairly smooth and covering a wide area to protect your brain. As our bones are getting produced through intramembranous ossification, there's going to be regions that I'm circling here on the right side that are not fully ossified. Those are regions that are still, mesenchyme. These areas are still mesenchyme. Mesenchyme being that embryonic connective tissue. It hasn't yet differentiated. The term for this, still present in infants, these areas that have not fully ossified, these areas are called fontanelles. Fontanelles. Why have they not yet fully ossified? It's really important that they do ossify so they can protect the brain, but why have they not yet fully ossified? What would be the advantage of having a soft, flexible region? Hopefully you've thought of it. The advantage of having a soft, flexible region is that as the baby is being delivered out of the vaginal canal, it needs to change shape a little bit. The head is a pretty big thing and it needs to fit through a narrow space. So having fontanelles is an advantage in that it can get through a birth canal and then the infant can be born into the world. So soon after delivery, well, not soon, but in the coming months, those fontanelles will go away. But you can feel those soft spots on a baby's head. If we wanted to, some cultures do this, you could even shape a baby's head in the way you'd want, in a certain way. Because those areas are soft and still malleable, you could change it to a certain pointier or flatter shape. But the point is, fontanelles still developing. They're still developing through intramembranous ossification. These fontanelles have different names. So let me clear my drawings here and let me point them out. The anterior fontanelle is on the top of the head. It's anterior and it's right on the top, superior. It's kind of at this intersection. There's an intersection between the frontal bone and the parietal bones. And then between that sagittal midline area. Right here is the anterior fontanelle. There's just one anterior fontanelle. If you follow the anterior fontanelle backwards, you'll find another fontanelle. That would be the posterior fontanelle. So you can't see it very well with this lateral view, but it would be up here. From the superior view, you can see those best. Anterior fontanelle, posterior fontanelle. Then on either side, there are two of these. Going back to the anterior fontanelle, if you go lateral on either side from the anterior fontanelle, you'll find something called the sphenoidal fontanelle. Why sphenoidal? There's this bone called the sphenoid that we're going to go over here in a minute. But the sphenoidal fontanelle is over here that you've best seen from the lateral view. There's one on either side. Sphenoidal fontanelle. There's a bone called the sphenoid in that area. Follow the sphenoidal fontanelle posteriorly behind the ear, posterior to the ear, the otic region, and you'll find the mastoid fontanelle. Mastoid fontanelle on either side. The word mastoid means breast-like, like if you have a mastectomy or you get mastectomies or breast removal. That's usually done if someone has breast cancer. But this rounded portion behind your ear is breast-shaped. That's where it comes from. Hence mastoid. Oid means like-ish, breast-like. So mastoid fontanelle is back here, one on either side. Sphenoidal fontanelles, anterior, posterior. Those are intersections of these soft mesenchyme regions. Let me write that down again. Regions of mesenchyme that will ossify after birth. Now you'll notice that these fontanelles are connected by regions of mesenchyme, which I'm going to shade over with black. These fontanelles are connected. These regions that I'm coloring in black, these regions are called sutures. Currently, these sutures are mesenchyme. The sutures will soon turn into ligament. The sutures will soon turn into dense, regular connective tissue. Ligaments are made of dense, regular. We'll name the sutures here in a minute. Now, there are 8 bones of the cranium. There are 8 bones that protect your brain directly. Many of them have holes. Many of them have foramina, canals, meatuses that allow the passage of blood vessels, of important nerves that we'll be going over soon. You can see in this lateral view of the different bones, the frontal bone is in front. It's one big frontal bone. Let me actually go back real quick. There's one big frontal bone here. In an infant, it's actually 2 different bones. In an infant, there's actually 2 different bones. The frontal bone fuses together to form a single bone as adults. we have a single frontal bone. It used to be two, it fuses together. So there's no ligament in between. So there's just one frontal bone. Parietal bone, there's one on either side. 1, 2. Occipital is all the way in the back. Temporal is by the ears, or it is where your ears are. You have 2 temporal bones. Sphenoid is just anterior to the temporal bone, and there's only one, and it spans from one side to the other. It's really hard to appreciate the shape of it right now. I'll show you what the sphenoid looks like. And then the ethmoid, you can't even feel without like rubbing out your eye. Don't do that. It's deep, hiding behind your eye, and it's also deep, very medial, just like a deep part of your nose. So we'll take a look at that. I was mentioning these sutures. Let's name these sutures. I'm going to name the one exception here. It's still called a suture, but it's not a suture in the sense that it's not a ligament. I said that ligaments are made of dense, regular connective tissue. Dense, regular connective tissue, an extension of the periosteum, the outer coverage of bone. These sutures are strong. They hold these flat bones together to protect your brain. The one exception here that is not made of dense regular is the frontal suture. It is not a true suture. It's a bony fusion. This one here, forming a single frontal bone, it's not truly a suture. It's called a frontal suture, but it's not truly a suture by the definition that we have here. The rest are. So frontal suture, it's called frontal suture. It's actually just bone to bone fusion. The suture, the true suture that comes across your head like this, intersects at the anterior fontanelle and also at the sphenoidal fontanelles. This is called the coronal suture. This is the coronal suture. I'm coloring it here in blue on the bottom picture, coloring it here in blue on the top picture. Coronal suture. Coronal because it forms like that coronal cut. I know coronal and frontal cuts are the same thing, so I'm trying to use the word coronal here. We wear it like one of those tiara type crowns. Coronal suture is between the frontal and parietal bones. The suture that goes from the anterior fontanelle back to the posterior fontanelle. This is the sagittal suture. Sagittal suture goes from the anterior to the posterior fontanelle. In the back, looking at the back of the head, which I'm coloring here in red on the bottom right and then red at the top right. This is called the lambdoid suture. Lambdoid is a funny word. If you're familiar with the Greek alphabet, you might know the Greek letter lambda. Maybe you play Half-Life or you know the units for wavelength. Lambdoid is shaped like this Greek letter lambda. You see this triangularish part here? It's the same thing you see down here. That's why it's called lambdoid. It's a weird word. Lambdoid suture is between the occipital bone and then the two parietal bones. And then this last suture, which is best seen from a lateral view. Coloring in this purple, if you can see it. This last suture is the squamous suture. This is a flatter part of your head on the lateral portion. That's what squamous means, right? We've learned that word before. Squamous is flat. These are flatter portions of your head. I think it'll help to see this in 3 dimensions. So we're going to have Complete Anatomy help us out with this. I'm going to show you where to get those videos. If you go to the videos of axial and appendicular skeleton, scroll down to Complete Anatomy. I'm going to click on skeletal system and articulations. I'm also going to click on basocranium so that you can see the ethmoid and sphenoid better. And then we're going to take a look at all those terms from the Chapter 7 study guide that I'd like you to know, all the different bone features. So if you click on, say, the skeletal system and articulations, open up Complete Anatomy, and you'll see something like this. At the top, it says View Screen Mode. I'm going to X out of that. I'm going to keep current model position. Okay. Looking closer at our skull. Let's look at those fontanelles first, along with the bones that we're looking at. Do you see this little crack there? That's part of the frontal suture. It really should go up all the way. Sometimes it's not always as visible, but that's what it's representing. This is the frontal suture, which again is not really a true suture. It's a bone-to-bone fusion. The frontal bone is just one big bone. The frontal bone is one big bone. Besides the frontal suture that I'd like you to know in terms of bone markings, the one other bone feature that the frontal bone has that I'd like you to know is the frontal sinus. A sinus means this bone is pneumatized. There's air spaces inside of the frontal bone. You can't really see them just like this, so we're going to have to cut into it. If you click on the basocranium link, it'll already be cut, and you can see in that. I'm going to cut straight into it right now just so we can appreciate it. Whoops. Let's cut that in half. And let's take a look. So you can see I just cut the frontal bone, and you see these spaces here. There's air-filled spaces in the frontal bone. These are the frontal sinuses. So frontal suture is one bone marking. You should know frontal sinus is another. Looking from a superior view, let me add the frontal bone back in. I guess I can't do it right now. I'll do it later. Anyways, looking from a superior view, we can see where this suture is. This is the coronal suture. And then this suture running this way, this is the sagittal suture, because it's running sagittally. Coronal, sagittal. On either side is the parietal bone. There are no bone markings I'm asking you to know for the parietal bone. So there's one parietal bone on the left. There's one parietal bone on the right. This posterior view, you can see the occipital bone. There's one occipital bone in the back, and bordering the parietal bones, this suture is the, lambdoid suture. Occipital bone in the back. This is the lambdoid suture. If we go lateral, on either side, you would have a temporal bone. There's the temporal bone. And then this suture running across this way, this would be the sphenoidal suture. The location of the sphenoidal, what did I say? Sphenoidal suture? I'm sorry. This is the squamous suture. Squamous because it's flat here. What I was trying to say is that here is where the sphenoidal fontanelle would be. And over here is where the mastoid fontanelle would be in an infant. But you can see that the bones have almost come together. In between these bones, tiny, tiny ligaments holding it all strongly together. Let me actually go back to the occipital bone. If we look at the occipital bone, we can see that, and you can feel it on your own head. Feel on the very back, there's a bump right here, very medial and posterior, there's a bump. That bump has a name. Term for this bump is the external occipital protuberance. External occipital protuberance. This bump is to stabilize your neck. Do you see this ligament that attaches to it? Don't worry about the name of the ligament. I'm not going to test you on it. But this ligament helps stabilize your neck. It's the ligament that you would injure, among other things, if you were to experience whiplash. So the external occipital protuberance is an attachment point for this ligament, a ligament that helps stabilize your neck. That's one bone feature of the occipital bone you should know. Another feature, if you look closely, you can see that this first vertebra, is balancing on the occipital bone at these points. This first vertebra is balancing on your occipital bone at those two different points. If I isolate the occipital bone by clicking on it, takes a minute sometimes between this and Zoom. Okay, I'm going to isolate it and look on the underside. I'm going to look inferior. We were just in this view, and now we're looking on the underside, inferior view. These smooth parts, those are called the occipital condyles. The occipital condyles are these smoothed portions of the occipital bone, inferior portion, so that it balances on your first vertebra, the atlas. You may also notice that there's this really large hole in the bone. This really large hole is called foramen magnum, literally means large hole. And this is where your medulla oblongata, the last part of your brain, extends and continues on to the spinal cord. This is a hole for the transition from your brain to your spinal cord. If we isolate your temporal bone, we can find a lot of important features here. This is from a lateral view. This protrusion this one here, extending like this. This protrusion is articulating with this bone here. This cheekbone is the zygomatic bone. So the term for this extension of the temporal bone is called the zygomatic process. Things are often named after what they articulate with. The zygomatic process of the temporal bone articulates with the zygomatic bone. I mentioned how if we're an infant, this area is the mastoid fontanelle. See this rounded portion here? This rounded portion is known as the mastoid process. You can feel it behind your ear, posterior to your ear, the mastoid process. It's an attachment point for muscles. We'll go over a muscle called the sternocleidomastoid. You will see another protrusion. Do you see this one extending down very sharp? This one is sharp like a pen. In Latin, pen is stylo. If you know French, stylo means pen. This is the styloid process. Styloid process. You may notice that the temporal bone articulates with your jaw, or it forms your jaw with your mandible. This curved region of the temporal bone articulates with the mandible, and it's a depression. This is called the mandibular fossa, the mandibular fossa of the temporal bone. From this lateral external view, we see that there is a hole here. This hole, since we're looking from the outside, this is the external acoustic meatus. It's your outer ear canal. External acoustic meatus, so sound can come in. Now, why do we have to distinguish external? Because there is an internal one. I'm going to clear this and isolate our temporal bone. Lateral view, here's the external. You can't see all the way through because the canal doesn't go straight through, it kind of goes around, moves and zigzags a little bit. But if we look on the inside view, the internal portion, Here's our, whoop. Here is our internal acoustic meatus. The external acoustic meatus is to allow sound to come in. The internal acoustic meatus is to allow a nerve to come out, or really to connect to our organs of hearing and balance. We'll go over all that in much more detail later, but there is a difference between the external acoustic meatus and the internal acoustic meatus. If I hide the parietal bones, we're going to look inside of the skull. We call this the base of the cranium, the basocranium. This is where the brain would also be fitting in. So this is the inferior portion of the brain is going to be bordering all of this. You'll see that there's a lot of interesting features here. This is a half-cut frontal bone. So that's the anterior side. You can see we just looked at the temporal bones on either side. There's one temporal bone. Occipital bone is right here. There's the occipital bone. But then what are these other bones that haven't been highlighted? This one that is very anterior, sandwiched within the frontal bone, this is the ethmoid bone. And posterior to it is the sphenoid. The sphenoid, you can see just a bit of it from the side. But to see most of it, you need to see from this view, from a basocranium superior view. Similarly, with the ethmoid, you can see more if you cut open the top of your head. If you want to see it from the surface, you'd have to remove the eyes, and you can see that they're a bit more medial. They are medial. You can see one side of it showing. There's only one ethmoid and one sphenoid. And they're both, as all of these bones are, both very important in protecting the brain and also having many nerves pass through. If I isolate the ethmoid, so let's look from an anterior view, or before I isolate it, notice how we can see it within the nasal cavity. The ethmoid forms the superior portion of the nasal cavity, as well as the division, the nasal septum, between left and right sides of the nasal cavity. So I'm going to isolate just the ethmoid. This portion here is called the perpendicular plate. The perpendicular plate forms a superior portion of the nasal septum. There was another bone there called the vomer that we'll talk about in the next video that also forms the nasal septum. There is one curvature here. Oops, let me get a better angle. Okay. There's one curvature here on either side in the bone, and there's another curvature here on either side in the bone. These curved portions are shaped like conch shells. You know, those shells you blow in to make a really loud horn sound? Well, kind of like, what's that story where the kids get stranded? Slipping my mind, but that shell. The one that I've labeled in green is called the middle nasal concha. Whenever we see CH in this class, in Latin, CH is a hard K sound, concha. Plural is conchi, So both of them are conchi. Middle nasal concha, middle nasal conchi. And then the one on top, the one in yellow, this is the superior nasal concha, plural conchi. Where's the inferior one? It's a different bone. But the superior and middle nasal conchi, those are bone markings of the ethmoid. Why do we have these weird curved shaped pieces that are fitting inside of our nasal cavity? They help swirl air so that we can condition, we can humidify, we can warm up air. The mucous membrane that surrounds them, they form the turbinates. You form turbinates. Oops. T-U-R. Turbinates. While the perpendicular plate forms the septum, the nasal septum. If you recall, I cut into the frontal bone and you could see air spaces in the frontal bone. Similarly, if I were to cut into the ethmoid, I'm not going to right now, but if I were to cut into the ethmoid, you'd find ethmoidal sinuses. Air spaces, so that air can flow in and humidify and filter and warm up air as we breathe it. This little peak at the top of the ethmoid, the superior portion. If you've ever looked at a rooster, it's got a little comb at the top. Literally in Latin, rooster's comb is crista galli. Galli means rooster. Crista, not crystal. Crista means crest. Rooster's crest, rooster's comb. This is an attachment point for a fused meninges part that we'll talk about when we get to the meninges and the nervous system. But that's why there's this thing that sticks up. All of this we can see from an anterior view. Let's clear this and look at a superior view of the ethmoid. Hopefully this closer up view, you can see the curvature. Here's a lateral view. Posterior view. This is a superior view. From the superior view, you can still see, whoops, oh boy. From the superior view, you can still see the crista galli. And you'll also notice that there's this region here that overall is flat, but it has holes in it. This region that I just bordered with purple is flat, but has holes in it. The term for this region, this is known as the cribriform plate. Cribriform means like a sieve. A sieve is like a filter. If those words don't make any sense, don't worry about it, but that's what it means. Cribriform plate is what it's called. Cribriform. C-R-I-B-R-I-F-O-R-M. Cribriform plate. Now, what are those holes? Why are those holes there? These holes are for nerves. Every single one of these holes, I'm not going to point to every single one, but every single one of these holes are for the olfactory nerves. Your nose is right here. If you want to smell something, you want it to go to your brain, and those nerves will go superiorly. Collectively, they're known as these holes where your olfactory nerve passes through. These holes are called olfactory foramina. If you remember, foramina is plural of foramen. So these are many of them. These are olfactory foramina for the olfactory nerves to pass through up to your brain. A lot of important features here that I'm asking you to know for the ethmoid. all for a reason. They play an important role. If we isolate the sphenoid and look at its important parts, well, before we isolate it, let's look at it in the context of other structures. First, you can actually see it from this anterior view. If you remove the eyeballs, you can see it from this anterior view. It makes up most of this posterior side of your bony orbit. You'll notice that there are some really large passageways on either side. There's one, there's another. You're not going to need to know this yet, but just a heads up, this is where many nerves related to your eye pass through. Not the one for vision, surprisingly, but for movement of your eye or for sensing stuff from your eye region, from your ophthalmic orbital region. This is your superior orbital fissure. A fissure is a long hole. You can clearly see this hole is long. The superior orbital fissure is different from this other hole that you can see right here. This hole is where your optic nerve goes through, the one that you need for vision. This is the optic canal. That's your optic canal. From the superior view, and let me show you from a lateral-ish view also, you can see that there is this little area this area here, this area here, it's kind of like a seat. You can sit in it. If you were a little person, you could sit in that little part. The term for this area, which let me pull a little more to the side. The term for this area here, this is known as the sella turcica. Literally means Turkish saddle, Turkish seat. I guess there were Turkish people that liked to ride horses and they had made good saddles maybe. I'm a little fuzzy on the history here, but that's what it's called. It's called the sella turcica. Literally means Turkish saddle, Turkish seat. If you look at the overall shape of the sphenoid, you'll notice that it has kind of this butterfly shape. I'm going to isolate it. Actually, let me go to an anterior view. All right, so we have isolated our sphenoid. We're looking from an anterior view. You'll notice that there are these protrusions here and here. The term for these protrusions, the one that's more lateral, is the lateral pterygoid process. The word pterygoid, you don't pronounce the P. Ptery means wing. So it's the lateral wing-like protrusion process, thing that sticks out. If you know the word pterodactyl, a pterodactyl is a dinosaur that flies because it has wings. So that's where ptery comes from. Ptery is Greek for wing. That's a lateral pterygoid process. And then the one that's more medial is the medial pterygoid process. We'll be learning about muscles that attach to these processes important for chewing, for mastication. If I were to cut into the sphenoid, much like the frontal bone and the ethmoid, you would see air spaces. There are sphenoidal sinuses here. There are sphenoidal sinuses. This is a superior view. This is a posterior view. Posterior going a little bit more inferior at this point. So you can see the sella turcica here. Sella turcica is here. Optic canal, superior orbital fissure, superior orbital fissure. We're going posterior and a little bit inferior because at this angle, you can see these really sharp, you can see these really sharp points coming out this way, and then the much bigger wings here. The really small one in blue, the sharper one, that's the lesser wing. The bigger one that I've outlined in pink, that's the greater wing. Once again, this is a posterior, slightly inferior view right now. This is a posterior, slightly inferior view. Those are our cranial bones, bones protecting the brain, directly bordering the brain, and the bone structures, bone markings, bone features that I would like you to know. In the next video, we'll go over bones of the face. And then after that, bones of the vertebrae, or bones of the spinal column, including vertebrae, sacrum and coccyx, and then finally the thoracic cage. So I will see you in those videos. Let me know if you have any questions. Leave questions in the comments in the discussion. I will talk to you all later.